Sometimes I didn't have anything to wear. I couldn't fit any of the clothes in my closet. I had clothes in my closets that are like from size 8 to 18, like the whole range, all of them in my closet. And I would hide in pictures. I would put my little friend in front of me, and I would just kind of get all in the back of my little friend, or I would have my kids in front of me when I was taking pictures. I didn't like the way I looked. I didn't like the way that I felt. I was becoming concerned as I grew older about like my poor health and my decisions, the impact it would have on my long-term health. I was feeling stressed out. I was feeling anxious. I was emotionally unavailable most of the time. So my good friend Monique introduced me to this program. She had reached out to me. She could see the drastic changes over the last 5 years. We became friends through our kids. And so I've known her about 10 years, and she could definitely see the difference. But it took me 10 months before I was really ready to start something, to start working and focusing on my health with her. But I had just gotten to the point where I was like Fannie Lou Hamer. I was sick and tired of being sick and tired. So I started this journey the Monday after my 6-month regular physical with my doctor. I was at the highest weight that I've ever been. My AC1 levels for my blood work I was pre-diabetic at the highest level, the highest range of being pre-diabetic. So diabetes looked like it was in my future, like if I didn't make changes. And that's not what I wanted for myself. I wanted to prevent being on medicines and, as long as possible. And I didn't want to go into my birthday was coming up. My 45th birthday was coming up in June. I just didn't want to go into the latter part of my 40s or, going into my, thinking about longer term 50s and developing all these chronic conditions of diabetes, heart disease, high blood pressure. And this is prominent in my community.